Hello and welcome back to Curry Soup. Today we're going to be talking about dengue. Dengue is the most common and most important arthropod-borne viral illness in humans. Everyone who's watching this would have heard about dengue at least once in your lives. So today we are going to be taking a look at how dengue actually spreads. How does it transmit? What happens once the virus enters the body? And the phases of dengue. So without wasting any more time, let's get straight into it. Before we start, just an interesting tidbit. The earliest documentation of dengue was actually in the Chinese Encyclopedia of Symptoms during the Qin Dynasty. It was called the water poison disease because it was associated with the flying insects near the water, which is, as we know now, mosquitoes. So we know one common thing. Dengue spreads because of mosquitoes. To be more precise, the mosquito is called the Aedes Mosquito. There are two subtypes of these mosquitoes which are actually predominant in Malaysia. So let's say a mosquito comes and bites us, a dengue mosquito comes and bites us. When the mosquito is actually sucking blood out of us, it's actually also transmitting this dengue virus into our bloodstream. And right under our skin, we have these cells called dendritic cells and macrophages. So what these viruses do is, if you remember from the video of antibiotic I did speak about this a bit. Viruses are more like spies. They enter the body and they hide themselves within the cells. So what these viruses do, the moment they enter the bloodstream, they find these macrophages and dendritic cells and go inside them. And they are like this packeted ball, sort of like a Trojan horse for viruses. So once the virus enters the cell, it starts to open up and release the RNA strand, the genetic makeup of the virus into the cell. And inside here, this virus starts replicating, starts multiplying itself over and over and over again. And once they are done replicating, they repackage themselves and burst out of the cell. Now they'll start infecting every other cell around them. So let's say someone is infected with dengue virus already. They have an infective phase. An infective phase means like 4 to 5 days when they can transmit dengue to mosquitoes. So if let's say someone just got infected, they don't know because the fever hasn't started yet, and right now a mosquito comes and bites them again. Let's say this is a healthy mosquito. What's going to happen is this virus is going to be sucked into the mosquito, and inside the mosquito from the abdomen it moves all the way to the salivary gland and starts replicating there, and they live there. The mosquito will be infected for life. For life in a mosquito's life is like 21 days, I think. So yeah, but the mosquito will remain infective. That's why if let's say even there's one mosquito, it can infect the entire house within like 24-36 hours. And that's how dengue spreads. So there are 3 phases of dengue fever: the febrile phase, critical phase, and the recovery phase. The febrile phase usually starts after day 4 to day 7 of that person getting bitten by a mosquito which is positive for dengue. And it starts with very high grade fever, headache, retroorbital pain, meaning pain behind the eyeball. And whenever the doctor asks, is there fever, headache, retroorbital pain, they're always looking at dengue. The eyeball pain is sort of like a key indicator for dengue. Besides that, they also have myalgia, which means basically muscle pain, and arthralgia, which means joint pain. And other non-common symptoms or more rarer symptoms are like nausea, vomiting, abdominal pain, diarrhea. Most dengue patients would transit straight from febrile phase to recovery phase. But then a very small percentage of people would go through critical phase. This would happen if this was a reinfection with dengue, meaning they already got dengue once before and now they're getting dengue again, but then of a different serotype. Serotypes are basically the types of dengue virus. There are a total of 4, which is actually abbreviated DENV1 to DENV4. Or they might go into critical phase if they have a lot of other comorbidities. One thing which would happen in the critical phase is thrombocytopenia, which means low thrombocyte counts in the blood. And this could lead to bleeding, melena. Melena is basically bleeding in the upper part of your gastric system. So you'll have black tarry stool, very sharp smelling black stool. You'll have bleeding from your nose, vomiting blood, and this could lead to dengue hemorrhagic syndrome, which loosely translates to excessive bleeding because of the dengue virus in his body. The next thing which could happen is called vascular leak. Basically, you're losing fluid from inside your blood vessel to the external part. And when the body starts losing fluid, certain organs will be affected very, very fast. For example, the kidney will have acute kidney injury. It could lead to liver failure. And if you're losing too much fluid, it can even affect how the central nervous system works. And this would all lead to dengue shock syndrome. And finally, there's the recovery phase. This is when the body starts returning back to normal. The blood vessels which were leaking fluid earlier starts returning back to normal, starts repairing itself. The risk of bleeding inside the body, for example, the melena I told you earlier too, or vomiting out blood, the risk of it reduces. But the patient might still be in a very fatigued state because they just lost a lot of fluid. The body just went through a lot. So it might take some time for them to recover. And that's everything about how dengue dengue transmits, what happens once the virus enters the body, and the phases of dengue fever. If you found this video to be valuable, if you learned anything at all from this video, the only thing I ask is for you to share this video with your friends and family members, spread the knowledge. If you haven't subscribed to us, go ahead and smash the subscribe button right there. And please do click the bell icon because YouTube's algorithm is changing all the time and we want to make sure our videos come and reach you. And until the next informative video, and anything you do, do your best and be the best version of yourself. Bye bye.